I worked for 30 years taking care of children. And I am also a member of the movement to end privatization of Medicare, as well as national single payer. And as many of you know, Attorney General Pam Bondi was here last week to tour Alcatraz, saying that we needed to turn this prison, we needed to turn Alcatraz back into a prison to keep our citizens safe. Well, I have a message for Attorney General Bondi. Prisons do not keep us safe. Do you know what keeps us safe, Attorney General? A living wage keeps us safe. Parks, green spaces, good schools, well-trained teachers, and teachers that are paid well keep us safe. Safe water, drinking water, clean air, vaccines, that keeps us safe, not prisons. And one of the things that would keep us safe is a healthcare system for all. Today is Medicare's 60th birthday. We're here to celebrate Medicare's 60th birthday. And, you know, Medicare 60 years ago integrated all of America's hospitals. It cut the poverty rate of seniors by 1/2. It saves rural hospitals. It pays for medical education. It is the bloodline for 69 million seniors and people with disabilities. It is the force for justice and progress. That's what we need. But we need not only for those who are 65 and over and the disabled, we need Medicare for all. And that's what we're here to celebrate. We're here to celebrate Medicare, but we're also here to demand that we have a healthcare system for everyone. Everyone should have Medicare. We should have not-for-profit healthcare for everyone. And we're handing out some flyers. Please take the flyer and sign our petition. We're demanding Medicare for all. That's what we're here to do today, and to tell Attorney General Pam Bondi that prisons do not keep us safe, that Medicare for all would keep us safe. Thank you.
So one of the groups of people who are suffering in this country are not just the patients, but healthcare workers. I was just at a strike yesterday, Hospice East Bay, where healthcare workers are fighting for a contract to protect their members who are suffering. They want to cut their healthcare benefits. Can you imagine that? In a hospice, they want to cut their healthcare benefits. All healthcare workers, all people should have healthcare. And at UCSF in Oakland, they took away their healthcare benefits. They're trying to put them into the other UC system, which will mean that they'll have to pay healthcare. Why is it that healthcare workers in this country are not paid, their health care is not being paid for? What we're here today is to say we need single payer, we need health care for all, and the fight of NUHW for their members is very important. So we want to welcome Gordon Marr, who's with National Union of Healthcare Workers. Welcome, Gordon.
Thank you so much, Steve and Anna. Good afternoon. I'm Gordon Marr, former supervisor here in San Francisco, but today I'm proudly representing my union, the National Union of Healthcare Workers, which Steve just referred to on some important struggles in the East Bay. I'm really honored to really join you all here today and at the bigger action this afternoon, celebrating 60 years of Medicare, one of our nation's most powerful public programs, and really a reminder that healthcare is a right, not a privilege. But we're also here today to really sound an alarm about a really dangerous and deeply immoral shift in priorities that really threatens to take us backwards in this country, and really here in our city in San Francisco. Medicare has saved lives. It's reduced poverty, and it's brought dignity to generations of elders and people with disabilities. Our NUHW members, nurses, therapists, mental health counselors, and caregivers work every day to deliver quality care to Medicare patients throughout California. But they also see what happens when care is underfunded, delayed treatment, short staffing, and health disparities that hit hardest on low-income and immigrant communities. But instead of investing more in care, Donald Trump is proposing that we reopen Alcatraz, not as a museum or a memorial, but as a federal prison to detain undocumented immigrants and those he deems a threat. Let's be clear, reopening Alcatraz as a prison isn't about safety. It's about fear, cruelty, and control. This is a disgraceful misuse of public dollars. We should be expanding healthcare, not building prison islands. Here in San Francisco, we have a different vision. We've made a different choice. As a supervisor, I helped pass legislation to supporting Medicare for all and also protecting immigrant families through our sanctuary city ordinance. And our city pioneered Healthy San Francisco, one of the first programs in the country to offer universal care at the local level. We believe that budgets reflect values, and our values demand that public dollars fund healing, not harm. NUHW members stand united in saying no more money for cages, no more cruelty in our name. We demand health care, not handcuffs. And on the 60th anniversary of Medicare, we call on elected leaders at all levels to invest in care, not criminalization. Expand Medicare, fund community health, protect immigrant families, and end the cycle of punishment and neglect. This is not just about a program, it's about the kind of society we want to be. So thank you to everyone for standing on the side of care, dignity, and justice. NUHW will continue to fight alongside you to ensure that our public dollars go where they belong, to the health and well-being of our communities. So thanks again to everyone for here in San Francisco and really throughout the country for celebrating the 60th anniversary of Medicare today, but also connecting it to the really urgent struggle to protect care and invest in our communities. Thank you.
Thank you, Gordon. And this is the 60th anniversary of Medicare. Medicare, as has been reported earlier, saved people in this country. It saved seniors so that they could get health care, they could take care of themselves. But one of the problems on the 60th anniversary of Medicare that the politicians want to privatize it. And how are they doing that? They're doing it by so-called Medicare Advantage. Medicare Advantage is a company, the insurance industry like United Healthcare, which say that they're going to take care of the healthcare needs that aren't covered by Medicare. What are those? Dental care is a healthcare need. It's not covered by Medicare. Hearing is a healthcare need. It's not covered by Medicare. So what we need is to make Medicare and cover everything, as it does in other countries like Denmark, like England, like France, like Sweden, like Switzerland, like Japan, like Korea, like China. They have health care. They have national health care. What would single payer mean? It would mean that you have a program that covers health care from when you're born to when you die. So you don't have to take it out of your pocket. What is going on in San Francisco and around this country? People go bankrupt because of healthcare costs. And these insurance companies don't care whether you live or die. In fact, they're using AI, artificial intelligence, to deny people their health care. This is wrong. How can you use AI to deny people for health care? Why? Because it's for profit. That's why. The whole system of healthcare in this country is based on making profit. We say healthcare should be for people, not for profits. United Healthcare, the murder of the head of United Healthcare, Brian Thompson, by Luigi Mangione, took place because he was protesting what was going on with healthcare in this country. We're against those kind of actions, but people are fed up in this country. People are angry about the fact they can't get health care. People are angry about the fact that they're being denied for health care needs or being postponed. If you're postponed for your health care needs, you die. That's what happens. You get sicker and you die. So we have some other people here who we'd like to introduce to come and speak, because this is a broad issue for all working people. Also, I want to talk about what's going on with the workers here, because the workers are members of the Inland Boatmen's Union, and they were just able to negotiate a contract here at this company. And if they turn this into a prison, they're going to lose their jobs. There are many tourist workers in San Francisco. They will lose their jobs if this is turned into a prison. Who will it benefit? Who will it benefit? Well, it'll benefit the political agenda of the Trump administration, who say that the main problem in this country, we don't have enough prisons. I say the main problem is we don't have health care for all. We don't have single payer. That's a real problem in this country. So if somebody would like to speak, Connie? Okay, thank you.
Would you like a cough drop?
Hi everyone, my name is Connie and I'm with California Alliance for Retired Americans. I'm also a retiree of SEIU 521 and Working Families Party. I'm part of all these groups that really are just saying, why? Why are you doing this? You're just doing this for profiting all the jail people who want to own this place and make money. And as everyone has said, Steve and Gordon, we really need to have health care for everyone. And so many countries have it. So many countries have health care for everyone. Oh, you want me to hold that? Okay. So many countries have health care for everyone. And on a nation this large, and economy is usually good, except it's down now. But an economy like this right now, we, as Americans, should have had this so long ago. Like Medicare, it helps me. I just turned 65, so I now have Medicare, which helps me a lot. But I'm also out here not just for me, but for the next generation, all these kids, everybody. Everybody needs to have health care, for mental health, for women's security and rights and everything. So I want to make sure, I just wanted to come out here. I'm from the East Bay, but I wanted to come out here just to say we all need health care, and it should be for everyone. Thank you.
Alcatraz Prison has also become a place for the commemoration of Native Americans. And Native Americans have an anniversary every year to commemorate. This used to be and is Native American land. They were here first. So we have Alan, who's going to talk about the work that he did to defend the Native Americans who set up a camp at Alcatraz. Welcome, Alan.
Hi, I'm Alan Cooper, member of PNHP, among other things, and Democratic Socialists of America. And in 1970 or 69, the Native Americans went out to Alcatraz, which was empty. They had left the prison, and they occupied it. And it became a big deal. It was on the national news, and every day, a whole tribe was living out there. And so residents, which I was one at San Francisco General, set up a clinic. And we went out to Alcatraz, and we took care of them. That's a stupid way to have to provide health care, okay? But we did it because there was no other way for them to get health care. Once they had left or off the reservation, they were no longer entitled. Their health care all had to come from the government through the Indian Health Service. So, and I can say at that time, the place was a mess. And it has, I'm told, I've never been out there since, in the, whatever it is, 50 some odd years, but it's become it was a mess then, and it's a worse mess now. The notion of using it to be what they call alligator Alcatraz, this will be shark Alcatraz. Not only is that stupid, but the sharks in the bay are all tame, they're leopard sharks. So that shows how much our president tends to know about what's going on out there and how much it would cost to be a place to deport immigrants, which is the goal. People like my parents, who are first generation, my grandparents never became citizens, and they could have ended up out there. And if he takes it far enough, if they're not citizens, I could end up out there. I think that would be bad. So we need to stop the stupidity of building massive amounts of prisons and use that money, because that's money that was taken away from Medicaid to fund ICE. ICE is getting almost as much money as they are going to take away from Medicaid recipients. And that is unconscionable.
Thank you, Alan. And we're here today in front of Alcatraz Tours to say enough is enough. We don't want Alcatraz turned into a prison again, and they want to spend billions on it. And as Alan was saying, they passed a bill for ICE, $170 billion. At the same time, they're massively cutting health care in this country. That is a crime. People need health care in this country. Who are they representing? Are they representing the for-profit prison industry? Are they representing the people of this country who need health care? This is a question we have to ask. And the people of San Francisco do not want another prison. They do not want another prison. They want more health care. San Francisco General Hospital is threatened with budget cuts because of the cutback in Medicaid. This is a threat against the people of this country, against the people of San Francisco. The United States has the highest rate of bankruptcy because of health care. Why are people going bankrupt because of health care? The reason is because we have a private system run by the insurance companies. That's why people go bankrupt. We need to put our resources, our money into single-payer health care for all. We have to get rid of the insurance companies. We have to put the health care workers and the community in charge of health care. That will only come when we have single-payer for all. It will only come when we have health care for all. So this is what we're saying here today. We need health care for all. That means single-payer. And Governor Newsom promised when he got reelected that he would support single payer. Instead, he took money from the insurance companies and went to party during the COVID crisis, a party paid for by the insurance industry, the hospital industry. What kind of business is this when the governor takes money from the insurance companies instead of fighting for single payer? We're calling on the state legislature to have an emergency session and pass single payer for all. The state legislature, 75%, they have a super majority. They could pass a single payer in California. They could tell these insurance companies, we're putting you out of business, and the money that you skim off of health care is going to actually go for people who need health care. In California, we're the richest state in the country. We're probably the fourth largest economy. We can afford to take care of everyone in this state with full health care, but it means single payer. It also means that we, the working people and the unions, need to push for this. The privatization of Medicare that's going on its 60th anniversary is an outrage. Medicare has been privatized by Medicare Advantage programs. These programs like United Healthcare are actually preventing people from getting health care. They're denying people from getting health care. And in fact, they're using AI, artificial intelligence, to deny people getting health care. What madness is it that you use AI to deny people from getting what they need? Medicare was set up to say that you could get your care as you needed it. It wasn't going to be determined by the insurance companies, but that's exactly what's going on today. The insurance companies are deciding whether you're going to get health care, and they're doing that by saying they want to make a bigger profit off of health care. This is wrong. This is anti-human. It's anti-working class. We need national health care. We've got to get the insurance industry, and with certainly Attorney General Bondi and Trump want to make Alcatraz a prison again. They want to spend billions of dollars to turn it into a prison. What we're saying is that's an outrage. The people of San Francisco, the people of this country do not want more prisons. They want health care, a basic human need. This is what we're talking about, health care for all. And the right of health care is a human right. All working people should have health care in this country, in this world. We have enough money for health care in this country. You have 80 billionaires in San Francisco. 80 billionaires in San Francisco. And we can't afford health care in San Francisco? The reason is profiteering, greed. These people who own these insurance companies want to make more money off of health care. This is the wrong priority. We have to change our priorities in this country. We have to have health care for all. And certainly Alcatraz needs to stay as a monument, not as a prison. And in San Francisco, people need their jobs. The IBU, ILW ferry boat workers need their jobs. If it's turned into a prison, they won't have their jobs. And we're saying, let's protect their jobs. Let's protect the tourist industry. It should be a monument to what's wrong that you have prisons like this. In fact, actually, Alcatraz was used as slave labor. It was built with slave labor in California. California is a slave state, used to be a slave state, and today there are people who are slaves in California in the prison industry. And that's another aspect of what we're fighting here today, because the prison industry is making profit from prisons. They're using prisoners to do jobs that could be done by workers, but who's profiting? The owners of the prison industry. GeoCorp, which is a prison industry company for profit, they may even turn Alcatraz into a private prison for all we know. That's their mentality. How can we profit from prisons? What we're saying is we don't want profit from prisons. We want single payer for all. We want health care for all people in this country. People need to have health care. Actually, the declining, we have a rate in this country where people are dying younger. Why are they dying younger? Because they can't get health care. People in rural communities can't get health care. They want to close hospitals under these Medicaid cutbacks. This is what Trump and this Congress voted for. And we're saying that this is wrong. We need health care for all. And the people of this country should not be subjected to more prisons. There are enough prisons. In fact, what we're saying is Trump and the gangsters in the White House should be going to jail. Not the immigrants in this country who do the work. The immigrants do the work in this country. They shouldn't be put in prison. It's the gangsters really who are violating our laws, who are stealing our money, who are profiteering from slave labor. These are the people who should go to prison. It seems like Bondi has a lot of time to go to places like Alcatraz and say that there should be more prisons. How about investigating Trump and the people who are pedophiles?
Hi, I'm a resident of San Francisco, and I'm here to protest ICE. I'm here to protest the opening of Alcatraz as a prison. I'm here to support Medicare for all. Look at me. The end is in sight for me. But what about everybody who's coming up? That's what we're doing this for. All of you people who are out there, get out there and make this happen. Protect yourselves and your kids. I thought Attorney General Bondi would be here. And I really at this moment, I really wanted to be here and look her in the face and say, what the heck are you doing? Can't you open your eyes and use your brain? I mean, don't we know the difference between right and wrong? I mean, doesn't everybody know that it's wrong to deny money for health care? It's wrong to deprive money for education. It's wrong to ruin our society for the profits of, as was just stated so beautifully, the billionaires. I mean, we've got our society. Look at all these people coming off the boat from Alcatraz. They're here to see a national monument. You can't even get tickets to this place. It's so popular because it represents something good in our society. It shows us that prison is wrong. It shows that prison is dangerous. And everybody wants to see it. When I have guests coming to town, they make their reservations months in advance because we want to celebrate freedom. We want to celebrate good health. We want that. And we've got to do the work to make it happen. Is there anybody else? Well, I'll keep talking for a minute. I see some people in the audience who have devoted their lives to working towards Medicare for all. Still handing out pamphlets, still writing memos, still sending out emails. That's what got me here. She does the hard work. Yeah, Barbara. She does the hard work. She's on the ground. She's the boots on the ground. And we've got to step up. I don't know if you can see my backpack. Medicare for all. Climate action now. And you probably can't read this. It says Free Palestine. We can't forget that. Talk about war crimes and atrocities. It's impossible to do worse than that. It's impossible to do worse than that. It's get out of Gaza. Get out of Gaza yesterday. I mean, the urgency is incredible. I mean, just think about the meals you eat every single day. I think about the meals I eat every single day, about the showers I get to take, the water I get to drink. Don't you think about that for yourselves? I mean, what's our place in humanity if we don't support that, if we don't recognize it, if we don't value it, if we don't defend it? There are no Canadians here. Why? They don't want to come to our country because it's BAD. They don't want to be here. He stopped to listen to hear the other side. because what they hear in the news is what we hear in the news. How all these things are happening.
So what does it mean that people in other countries can get national health care? People in other countries can get their health care taken care of, but here people go bankrupt and are afraid to go to the hospital, are afraid to get sick. I mean, people in this country are afraid to get sick. That is sick. That means this country is very sick when people are afraid to get sick because they can't afford to go to a doctor. This is wrong, and it's a system problem. It's a system problem in which the healthcare industry is seen as a profit center. United Healthcare and these big companies had a conference here to invest in healthcare. And J.P. Morgan healthcare conference was held in San Francisco. What were they here for? They were here to make money by cutting healthcare from people who need it. That's why they were here. What kind of system is organized around cutting people who need health care from getting the health care? It's wrong. It's absolutely wrong. We need health care for people, not for profits. We need a system in which the priority is not prisons. We have enough prisons. We have too many prisons in this country. In fact, the prison industry makes profit from using prisoners. Instead of providing decent union wages, they're profiteering off of slave labor in the prisons. This is a wrong system that we have. It's a sick system. We need some changes. We need some fundamental changes in this country. And we're here today to fight for single payer. We're here today to protect Medicare, which is under attack by Medicare Advantage. And I also want to say that the unions, there are some unions that are actually pushing Medicare Advantage. This is wrong. Why should unions be pushing Medicare Advantage? Well, because some of the union leaders are getting money from these insurance companies like Emblem. The AFL-CIO is actually pushing Medicare Advantage. We have to change that. You can't fight for health care when you're fighting for privatization. This is really what's going on. And healthcare and everything is privatized for big business, for more profits. So we have to stop that, and we have to begin to really rally for working people. There are people like healthcare workers in San Francisco who are suffering. At UC, AFSCME and UPTE CWA members are being charged for their healthcare. Their healthcare costs are going up. This is wrong. Why are healthcare costs going up in this country? They should be going down. We should have healthcare for all. It should be free for all human beings. People in this country need health care. So we have a member here, a health care worker, a home care worker, is going to speak to us, Bradley Wiedmeyer. Welcome, Brad.
We're the long-term care workers at CIU. And I'm not speaking for my union. Unfortunately, they haven't endorsed yet, but we're going to get them to endorse going ahead. Because what's going on in healthcare is what's going on in education. Just like the effort to have exclusionary education with vouchers, where people have a second-class school system and people that get denied entrance to the top voucher schools, that's what they want to go back to on healthcare. And why do I bring that up? Because 60 years ago, Medicaid commanded that there be desegregation of health care. Even in the Bay Area, there were hospitals for second-class health care. And for the hospitals to get Medicaid money, they had to desegregate. And this is what we're going to undo with this attack on Medicaid and Medicare, too. And Medicaid in California is Medi-Cal. And that pays for home care workers. The county, right now, our contract is completely backloaded for our contract period. And they can, if they don't have the money, they can tear up our contract, and we're not going to get the raises that they packed into the second half of our 4-year contract. There's not going to be the money there even to pay what they're paying us now with these cuts. And it's tough enough to get home care workers dedicated to the profession and the client. Right now, we're not meeting the quota. And then Trump's helping to destroy health care by deporting the 60% of immigrant home care workers. They're going after all the immigrants that are working with us, that are in our union, and our sisters and brothers. So all these things are building up for a health care catastrophe in the United States. They're going to resegregate health care. They're not going to say that they're doing that, but they're going to have a two-tier economic control over it, just like in the schools. Vouchers are exclusionary education. They deny the right to all students to have a decent education, and they'll build a two-tier system. And that's what's going to happen with home care. And that's what Medicaid that we're celebrating now did. And it was the fight of the unions and the public. You know, it's interesting hearing the recordings of LBJ, Lyndon Johnson, you know, handing out the first card 1 and 2 to former President Truman and Bess, the First Lady Bess, in their 80s. They were the first that got the Medicaid cards. And you hear Lyndon reading the script, and he sounds like he's a progressive social democrat. But how did we get to the point? We had to organize working people, the healthcare workers, and the recipients of care into a movement to bring us at least to that stage, and they're trying to undo that now. What we really need is to go forward into a single payer system, and the 20% of the healthcare dollar that is flushed into the pockets of the CEOs and the mismanagement of the healthcare system is robbing healthcare from people. And in Canada, when they started moving towards their single payer system, which is less than 2 or maybe even at some years 1% of the healthcare dollar, not 20% being wasted on management and executives and profit. Yeah, thank you. And so when they started out, they were facing the deepest, darkest days of the Dust Bowl and the Depression. And people from British Columbia and Saskatchewan and the Quebecois in the French-speaking Canada joined together to move forward to a single payer and one of the best healthcare insurance systems in the world. And this is in North America. Can you believe that? It's there. Yes, let's hear it for single payer. That is the answer. We cannot afford to throw away 20 cents on every healthcare dollar to the rich, to mismanage it, and to build an exclusionary two-tier healthcare system. And we have to move forward to defending and expanding disability rights in healthcare, because those are being taken away. 30 years ago, the disabled community won some level of humanity in our society providing health care. So I'm probably over time, but I just want to say from the home care worker community, we're fighting with you, but we've all got to fight together politically. And you know, new wine in old bottles doesn't work. And we've seen where the Democratic Party is not that Lyndon Johnson era Democratic Party anymore. We're not there. We need to build a Labour Party in this country, like in Canada and Australia and New Zealand and England or Great Britain, where they have single payer health care. What's wrong with us? You know, we've been propagandized on the market and the big business. It's time to get rid of that. It's time to join together and have a labor workers and a community party system going. Thank you.
And you know, it's really a crime that the home care workers in San Francisco are not paid a living wage. They have $21 an hour. You can't live in San Francisco for $21 an hour. And they have to fight for their health care as well. This city is a rich city. It's one of the richest cities in the world, as a matter of fact. Yet we don't have health care for everyone in San Francisco. In fact, Governor Newsom has said that he wants to cut off Medicaid and payments to immigrants who have health care. Everyone who is in California in this country is entitled to health care. If they get sick, it affects everyone. Disease is something that travels. We cannot afford cutting off health care to people because it threatens all of us. So our next speaker is Delia, and she's a student and a member of UAW 4811, and she is also fighting for health care for all. Welcome, Delia.
And thank you for being here, for just standing and stopping. I'm a student to be a social worker, and a lot of the families that I've supported and people that I worked with had no health care. People avoiding to go to the emergency room so that they don't have to be stuck with a $5,000 bill. People avoiding to go in to see their doctors because they can't really afford whatever treatment or medications they're going to be given. So it's time for this country that's supposed to be the richest first world country of the world to have a first world health care. It's a shame. We are like a third world country. It's a shame to see how we don't have education, we don't have healthcare, we don't have housing, we don't have anything at all. However, those that rule this country have everything, and it's all for them. And so it's time for people to wake up, people to rise up and try to fight for the things that we need. We're not asking for much. We're asking for necessities that people need to thrive. It's not asking for a lot. Being able to go to the doctor when you feel sick, it's not asking for a lot. Being able to even just go to the doctor when you suspect something's wrong, it's not asking a lot. So everyone should have that right. And it's wrong that people can't do that. It's just completely wrong. It's evil. There's money for genocide, there's money for wars, there's money for everything else except for the wellness of people. It's just simply wrong. And I hope people that have a heart, that have a conscience, can rise up and fight for these things for others. Please care for others. Don't just care for yourself. Care for others. Be a community for others. And that's all I can ask for and I pray for. And as a social worker to be, I will fight this with all my heart, and I'm hoping that more people will join and listen and fight for the things that we need. Because we just need simple things: housing, education, healthcare, transportation. These are things that all people should have, especially in the United States of America. Thank you.
Healthcare for all, that's what this rally is in front of Alcatraz Tours. We're saying that this, instead of spending more money for prisons and making Alcatraz a federal prison, probably privately run, because that's where they're going, they're privatizing the prison industry to make more profits. That's wrong. These people want to make billions of dollars from privatizing our prison industry. What we're saying is cut the money for jails and actually jail the real criminals. The real criminals are the people that are making money by killing people who can't afford health care. These are the real criminals. When you deny people health care and they die, I would say that's a crime. So that's what we're talking about. The real criminals are profiting from killing people for profits, and they're not for making us have a health care system that's for the use of people. The privatization of health care, the destruction of Medicaid, which is a Band-Aid on our healthcare system, are all about making more profits. And we're saying enough is enough. The people of this country want national health care. We need a single-payer system. So all the money that's collected, and we collect more money in this country for health care per person than any other country in the world. What's that about? Why are we spending more money for health care than any other country in the world, and millions of people have no health care coverage? It's crazy. So let's organize, let's build a campaign for single payer. I've talked to people here at the Alcatraz Tours who have health care in their country, from Denmark, from Sweden. All these other countries have health care for all, but we can't get it in this country. It's wrong. The priority is wrong. In fact, Trump is going to Europe and Japan saying they should spend more money in the military. What kind of attitude is that? We need less money for arms and military, more money for the people, for health care. That's what we need in this country. So, or anyone else would like to make some comments? If they have something to say, speak out. Now is the time. I also want to say that we're going to be having a rally at Harry Bridges Plaza at 2 o'clock. We invite people to be there. Harry Bridges and the ILW have been for single payer, that union. In fact, Harry Bridges was for national health care. He was from Australia. In Australia, they have national health care, but they don't have it in this country. So people in this country have to wake up. They have to demand it. Enough is enough. We need national health care, single payer for all. We need to protect the people of this country, whether they're rich or poor. That's what we need to do. People shouldn't have to be worrying about going to the doctor. It's a human right for people to have health care. So that's what we're about. Sign up, join our campaign, Single Payer for All. Thank you, brothers and sisters. Solidarity.